Okay, Coleman Dental Group up here with us this morning. I'm going to try to show some of this video right here, and then we're going to talk about it. Let's see. Where is play?
Periodontal disease is the major cause of loss of teeth in adults. Perio means around, and dental refers to tooth. What is around the tooth? The gums, or gingiva in dental terms. Underlying the gums is the jawbone, surrounding the roots of the teeth, providing strength and stability. There are two types of gingiva, attached and marginal. Attached gingiva is firmly connected to the underlying bone. Marginal gingiva is freestanding, extending from its attachment to the tooth about 1 millimeter. A probe placed between the gum and the tooth will stop at this attachment. If plaque collects in this small space, the marginal gingiva will become inflamed. This condition is called gingivitis. Symptoms can include inflamed gums and bleeding when brushing or flossing. Allowed to continue, the gums swell more. The attachment of the gum responds to inflammation by migrating down the root. The bone level drops with the attachment.
We're almost done.
A probe now slips beneath the gum before stopping. The space the probe slips into is called a pocket. Plaque that collects over time hardens into calculus. Calculus is very irritating and causes further inflammation and bone loss. When bone loss occurs, the condition is known as periodontitis. Allowed to continue, bone loss will cause eventual loss of the tooth. Periodontal disease can be localized or widespread. It can also be moderate or severe.
I was going to say Coleman Dental Group is just like so excited right now, but they're all asleep.
Well, that's
You know, we joke about that, but that's important.
that's all you needed to know about gum disease in 2 minutes or less.
It looks like that's something we don't want.
No, absolutely, and you know, it's the reason I think it's ignored so much is that it doesn't hurt and you don't realize you've got it for a long time. When it does hurt, unfortunately, it's too late for a lot of teeth. So,
Gum disease, does that have anything to do with the rest of your body as well?
Yeah, absolutely. Gum disease has been indicated in things from Parkinson's, heart disease, stroke. They found the same bacteria in other situations, so absolutely it does. And talking about New Year's resolutions, a lot of people are getting to the gym, started getting healthy again. Well, you need to start in the right place, and that's with the oral cavity. So if everybody would get in and get started right, get it cleaning, and we can go from there. And we've got some new protocols in place to treat gum disease in our office, and I think it's a good way to start off the new year.
I think so too, and one thing that I've done is starting to floss more. Actually, Lacey, your office sent Cassidy a reminder it's time, to come back in for getting your teeth cleaned and everything, and you had the cutest little, it looked like a credit card, and it was actually floss.
Yeah.
And that was really, I mean, it's easy to stick in your purse, stick with your credit cards, and just a reminder every time you open that up, make sure you're flossing more, because a lot of us are guilty of not flossing as much as we should.
Yeah, floss is relatively inexpensive, so just go by the pharmacy, go by Walmart, Kmart, and pick up several little boxes and just keep them, where you are. Keep it by your recliner, keep it in your purse, keep it in your car, don't floss while you're driving. But,
Yeah, I haven't seen that one. I've seen everything else, but not while they're driving, but not flossing. I did notice when we went out to eat, Alan, you grabbed a toothpick.
yeah. Well,
Just to call you out on it, and it's not bad as long as you're using them properly.
right, yeah. The little plastic picks that you can get in our office are a little safer. Sometimes that wood will splinter and it doesn't feel too good.
That could cause a lot of irritation.
Yeah, we're excited about the new year. We're actually putting in some new equipment for actually treatment of gum disease. So
Great.
Lisa shared that with us yesterday, and we're excited about that. So our resolution is to try to screen everybody for the disease and try to treat them as comfortably as possible, and so keep those teeth.
I imagine there's probably times that you've had a patient where you can tell that something really is wrong, you know, with their medical side because of their teeth, and with all the candy, all the sodas, and just and a lot of I hate to say this, but drugs out there that are damaging to teeth. You guys are probably seeing a lot more of that.
We are.
Oh, yeah. Almost any medicine today makes your mouth dry, and that has an effect on the
your
health
teeth.
of the oral cavity. Yeah, sure
Didn't think
does.
about that. What are some things for kids that you can do? How soon do you start getting them to brush their teeth? When they first get that first tooth, or I mean, get them a toothbrush?
As soon as they get that first tooth, really before, even when it's just, you know, just the gums.
Brushing the gums.
Yeah.
That
Yeah.
probably feels really good on their mouth too. Okay, and Lisa's told us before, when you get out there, when you go to a dentist and you have small children, bring them with you. That way they see everything's okay with mom and dad there in the chair, because I gotta tell you, it's terrible if you have a bad experience at a dentist at a young age.
Yeah,
I
show
did,
them.
and look at what a baby I was.
You're
until it
good.
went to you guys.
You're good now.
I'm
but
good
but
now.
it's important to show them that we're not scary people and it's not a scary place.
That's right. Well, thank you. And Patrick, you missed a good time traveling with us.
I was a little north of you. I was in Jacksonville.
I bet you did have a good time. Well, Lisa, Alan, just want to say thank you, and he is the best to travel with.
Is he not fabulous?
You know that. Yes, he is.
He
We're
is
gonna brag on him
really a
little bit.
great traveler.
I do want to
fun.
also tell you, if you're needing a dentist, taking new patients, you guys are doing that. And
Yeah.
You're located right across from Athens State College, easy to find, and call them up, personally
Yeah.
guarantee them. You'll be glad you did. All right, thank you
Yeah.
guys for being with
Thanks.
us this morning.